I'm very happy to introduce Dr. Patricia Watts, who's one of our art therapists, who is also the co-founder of the Centre for Creative Therapeutic Practice, is also a lecturer and trainer as well. And she'll be joined by Professor Simon Hackett for questions at the end, who is a Director of Research at the University of Newcastle and has as two of the people who've been working on this project. So I'll let you, Patricia, kick off and explain a little bit more, but certainly say it focuses on children with chronic conditions, and so it really links back to the presentation before. So thanks very much, Patricia.
Thank you for that introduction, Kat, and thank you for your presentation, Lynn. I think there's a nice lead-in to what I'm going to share around increasing the opportunities for children to receive support for their mental health and putting parents and carers in a place to be able to do that. So I am just going to share my slides. Okay, you'll see that okay? Okay, so what Kat hasn't mentioned as well is that I'm a Teapot Trust art therapist within the paediatric rheumatology team at the Royal Hospital for Children in Glasgow, where I've been for the past 8 years. So a lot of what has gone into this project really comes out of the work that I've done with children and young people over the years and working with their families as well. So this presentation is going to discuss the development of the GAIN project. So that's group art therapy and intervention for communicating the needs of children with long-term conditions. We can thank Professor Hackett for that name. Okay, sorry, I seem to have moved my slides on a bit too much. Okay, so what we noticed when we were thinking about putting a group together and developing GAIN, so we know that 27% of children and young people are affected by a long-term condition. This is defined as any health problem that requires a clinical follow-up of more than 12 months after the initial episode. And the most common long-term conditions in childhood are diabetes, asthma, and GIA, which we see lots of in paediatric rheumatology. We know that children and young people with long-term conditions are more likely to develop mental health conditions, and that puts them at risk of an increased risk of experiencing stigma, social exclusion, bullying and lower attendance at school due to having increased health appointments. But we heard a lot of the issues that young people face from the video that Lynn showed. And supporting a child with a long-term condition, it can also, for parents and carers, it can cause emotional distress throughout the whole family. Long-term conditions of any type can have a detrimental impact on parent-child interactions, leading to strained relationships. For example, when parents are having to inject their children, that can cause a lot of distress. And parents and carers can experience their own mental health issues, as Lynn has highlighted. That includes unresolved sorrow, anger, guilt, and worry and uncertainty, and worrying about other children that may be missing out on their time as they attend to the needs of their child with the long-term condition. What we do know is that family involvement in the management of long-term conditions can have a positive impact on outcomes for young people around goal setting and adopting positive health behaviours. So children are really motivated with their parents' support, and any interventions around supporting children's mental health in this area really should be designed in consultation with children and young people and their parents as well as practitioners. Art therapy is long considered to be a developmentally appropriate way to support children and young people with long-term conditions. It offers a different experience in their hospital journey. It's an experience where they have more choice over what happens to them, and it involves creativity and things that are fun rather than experiencing medical interventions. There is a lack of evidence into how effective art therapy is in paediatric settings in the UK, and that means that in some areas access to art therapy is limited because it's provided through charities like the Teapot Trust rather than it being a standard health intervention. So that was the backdrop for thinking about what do we need to develop here. Okay, so just move my slides on. Okay, so excuse me. So the GAIN manual is what we did. This is what we come up with. It was initially developed by myself and Professor Hackett between 2019 and 20. And we wanted to create a resource, a manual, an art therapy manual that art therapists could use to offer a group to children and young people with GIA that could be replicated across a number of different settings. So we were in clinical practice at the Children's Hospital in Glasgow. I was noticing a lot of children and young people coming through with similar referrals around needle anxiety, difficulty taking their medication, strained family relationships around taking medication, and it just felt like an opportunity to bring children and young people and their parents together. So in the early stages for the development of GAIN, we had a consultation with various partners, and one included a professional who also had her own lived experience of having a long-term condition, and she really helped to shape what a group might look like and what it might be able to achieve. We also had public and patient involvement advice, and that informed the shaping of the group structure and highlighted the need for involvement of parents and families. So a multidisciplinary team was then formed to create a steering group to discuss the project. The steering group members included myself, Professor Hackett, a clinical academic consultant paediatric rheumatologist. We had a hospital arts programme manager. We were fortunate to have the CEO of the Teapot Trust. We had a digital online arts therapy expert, a children's hospital research and innovations manager, clinical nurse specialists, and most importantly, we had the input from a parent and child as well. So the GAIN steering group met on 9 occasions. between 2021 and 22, to look at various drafts of the art therapy manual, and to really think about how we develop it to make it as accessible as possible, especially post-COVID. And that's when I think the decision was made for it to be an online resource. So that included looking at the group sessions, offering feedback, looking at worksheets and resources that children would be using in the group and at home as well. And the parent and child who were involved in supporting us took all of the materials home and worked on them together, and gave us really valuable feedback about what to change and what to develop, what to make more understandable, and where to make it more child-friendly. So all of the resources were adapted to child-friendly format for online use by a digital consultant. And then from that, the digital consultant created a platform, an online platform where all of the resources could be placed for parents, information sheets. So, and then we developed and refined the manual a bit more to make sure it was as robust as it can be. So I'm going to tell you now what the final thing was that we created. So again, as an online psychosocial manualised art therapy group intervention for children aged 8 to 11, diagnosed with a long-term physical health condition. So the online group work is augmented with additional materials and resources for parents and carers. So this included 6 groups for an art therapist to run, and parents and children would have concurrent sessions in between each group. And the resources were pretty similar, and I'll come on to that in the next slides. But the core aims of the GAIN manual were to work collaboratively with children and their parents and families, and to acknowledge children and parents' expertise in managing their condition. We wanted to empower children and their families to set their own goals for the management of their conditions. And an overall objective was to support group members to take age-appropriate responsibility for their health and well-being, and to communicate their needs, and supporting children and young people to have increased agency and self-advocacy using creative methods. So the resources were really about supporting them to speak about their worries and how to ask questions at medical appointments. And I will come on to more of that in the coming slides. It was really important to work collaboratively with parents for this group, and to see parents as the experts in their child's condition, as parents are often managing this on a daily basis by monitoring symptoms, administering medication, and navigating medical appointments, and offering emotional support and reassurance to their children. Okay, so we identified that 8 to 11 was the target group, and this was based on a previous Teapot Trust service review that showed us that this age group had the highest uptake of coming along to art therapy. So the group was developed for children at any stage in their diagnosis, from being newly diagnosed to children who have had their diagnosis from a much younger age. The group is aimed as a form of early intervention to support children at the earliest stage, with less time to wait for support and to prevent issues from escalating to needing more intensive psychological support. So the home sessions were aimed to offer parents accessible resources that can help them to have therapeutic conversations with their child about their condition. Okay, so here is a flow of the group and how it works. So it's the 6 art therapy groups and the home sessions together. So the programme consists of 6 90-minute online group sessions for children and young people that are facilitated by an art therapist, and 6 30-minute parent-led home sessions to complete resource worksheets for parents to complete worksheets with their children that are linked to the weekly themes of the online group. So apart from the first session, which is about the children all getting to know each other, all of the home sessions then introduce the children to what they're going to be doing in the group. So parents support their child to have a chat about some of the themes and the safety of their home environment, and that prepares children to be able to have a think about what they want to share and what they want to explore more in a group setting. So to participate in the group, members need access to a digital meeting space. So we would deliver it on Zoom, and need access to a PC or laptop and art materials for their own use. And each group has a printable resource pack for use in the group and at home. And at the end of the group, the child and their parent have got a tangible set of resources that they can go back to if they need to. So the group schedule runs through getting to know each other, celebrating me, taking care of my health, supporting honest conversations, taking care of my feelings, and stepping into my best future. And as I said earlier, the home parent-led sessions align with the group sessions to support preparation for group activities and increase family involvement. So I will run through the objectives for each group session. So getting to know each other is designed to help children to get to know their peers and facilitators, and to help children gain an understanding of the focus and the format of the group, and to help them take ownership of the rules and the boundaries of the group. More importantly, they come together with a group of other children, and they realise that it's not just me, there are other people my age going through this too. Okay, celebrating me was designed, this theme was designed in recognition that a lot of children can feel disempowered by their diagnosis, and the session aims to help children to think about their strengths, talents and achievements, and to understand that they're more than their condition. It's also a session where they will think about the losses and gains associated with their condition, and to have that validated and yeah, really acknowledged by the group, but also to think about the things that they can do rather than the things that they're not able to do because of their condition. Taking care of my health seems to help children to think further about their own physical and emotional needs, and to reinforce to them that they have a range of needs that are not always associated with their condition, and helping them to identify what those needs might be, and supporting them to focus on their bodily cues, and to recognise emotional as well as physical cues, and to think about age-appropriate self-care for taking care of themselves, and being able to communicate their health needs in a variety of ways. Honest Conversations was designed to help children think further about how they ask questions about their condition and the management of it, and to reinforce to children that they can ask questions about their condition. And when thinking about this theme, what influenced this was the number of children that I've worked with over the years, that if they don't know or they don't understand what their condition is, they'll go looking for the information themselves, and a lot of them can be overwhelmed by what they see, or they can feel quite down about things that they hear or things that other people say to them. For instance, feeling that maybe GIA is an older person's disease, which we heard a bit of that in the video. So this is about empowering children to help them find ways to ask these questions when they're at medical appointments, and saying, I maybe don't understand that. Can you say that again? Can you tell me that in a different way? And supporting them, to find out age-appropriate information, knowing who to ask for help, and to think about the importance of honesty when discussing their condition, how they're feeling, how important it is to share that you have a new pain or a new symptom that maybe no one knows about. Okay, so taking care of my feelings, helping children to think further about how they identify and share difficult feelings about their diagnosis. So thinking more about loss or anger, social exclusion, isolation, and to validate those feelings and let children know that they have a right to feel the whole range of emotions that they are feeling, but also to support them to think about where they get support for those feelings. Who do they speak to at home? Who do they speak to at school? And these are conversations that parents will be having with their child during the home sessions. And we know a lot of children don't like to worry their parents. So this is hopefully, giving children the message that everyone's working together here to support you, and that's not a worry that you should have. Okay, stepping into my best future is the final session of the group, and that's to support children to think further about their future goals, and supporting them with the idea that their diagnosis shouldn't hold them back from their future goals. And depending on the age of the child, helping them to think about how they manage their condition and their medical appointments and their medicine in future in an age-appropriate way. But overall, helping children to feel empowered about their condition and what they want to what their views are on that, and what decisions they would like to make in the future going forward. Okay, so the expected benefits of the GAIN group. We hope that this will be a group that can be set up and offered quickly to reduce waiting lists, and can be offered in a variety of different settings, hopefully at a lower cost. Having a therapy manual based on what is known to work in practice from previous groups, to support art therapists to offer a consistent group across the board. And that will make it easier for data collection to build the evidence base for art therapy, because that is very important to being able to grow services and increase capacity. Children will be seen quicker, and there'll be less time in a waiting list compared to having to wait for a one-to-one service. More children can be seen. And for the children attending the groups, knowing that they're not the only ones, and peer support, as we know, is really really important to facilitate a space where children can learn from each other's shared experience and reduce social isolation. We hope that parents will feel empowered in their role as co-facilitators, and they are able to utilise their experience, and supporting parents to have a space to discuss issues that parents themselves might feel they need the support of a therapist to be able to have these conversations with their children. As I said earlier, children parents are given a robust and tangible set of tools that they can take away and use to help them with the emotional issues that may come up long after the group has ended. And hopefully having a resource that children can access quickly as a form of early intervention, so issues can be addressed before they escalate to the point of needing more intensive therapeutic input, or even having to return to therapy at a later date. So I see I've went over time, so just to sum up, the GAIN manual aims to support self-management for families where there's a child with a long-term condition, for the child themselves to adopt age-appropriate strategies for the management of their own condition, reducing the need for ongoing therapeutic support. And it's hoped that this is something that we will be able to roll out across a number of clinics and settings to support children and young people with long-term conditions. Okay, I'll end it there. Thank you. Oh, Kat, you're on mute.
Yeah, sorry. I was saying, are you happy to finish there? Have you finished?
Yeah, I can finish there. Yeah.
Great, brilliant. So there, yeah, we've got a couple of questions. I think Simon from Attack It is in the room and was going to come on to answer any questions anyone had. So there was just a couple of things that you'd mentioned that people are wondering about, and one is around, you mentioned the digital practice and thinking about what were the changes that were made, if that's a fair question to ask, around what made it, what were the changes that you made to make that digital, that work as a digital resource, I suppose. Oh, you're on mute, Patricia.
And I was letting you know you were on mute. Okay, so the manual started off as a paper resource that was going to be designed for an in-person group, and then post-COVID discussions, it all became let's make this online. But there is a part of the Teapot Trust website that parents can log into, and all of the resources are there for them. So there are worksheets for each week, and there's a video talking parents through the resources. So it's a recording of me talking parents through, and it's an interactive platform online. Does that answer? Now you're on.
I could leave myself unmuted. Yeah, no, we can't. I don't know. We're just trying to find Simon in the group. We think he's here, but he was here earlier. Yeah, I suppose it was about the outcomes of the groups that have happened, and I suppose the other thing I was quite interested in was there any surprises that came out of that work that you weren't expecting, both either from children, young people, or families themselves?
Yeah, so we have run a group, a pilot group now. Megan and yourself, Kat, ran a group for children, and then we opened it up to young people as well. So there were two separate groups, and I think for us a surprise was that the younger age group didn't quite feel ready to start talking about the future and transitions into teen clinics or taking over medication routines themselves. So that was something, you know, to go away and develop and think about. And Simon has got lots of data from both of those groups that we're then going to use to improve I guess the design and some of the things that we're asking.
Brilliant, great, thank you. Lynn, there was a question about how you would like mental health care to be integrated into rheumatology care, which is quite interesting, having listened to how the groups have been working, but whether you had any sort of strong thoughts on that at this point.
Yeah, so across some of the paediatric rheumatology and adolescent rheumatology clinics at the moment, there are a couple of psychologists. So I can't name them all off the top of my head, unfortunately, but in Cardiff, a psychologist started just over a year ago, and we've had more long-standing roles at Alder Hay and Evelina. So some centres already have either a part-time or a full-time psychologist as an integral part of that multidisciplinary team, not just there for the children and young people, but also there for their colleagues as well, and to talk about different approaches and support that's available. I mean, the dream is obviously, right, that you'd have one of those in every centre, or at least access to that kind of support in every centre. Some of the centres do share with other conditions, etc. But that's one of the things that we as a group have sort of said, well, why do we have that over there but not over here? What does that mean for families? What happens when, like in Cardiff, you've introduced someone, like what is the impact of introducing a psychologist and the on children, young people and families? So we're really keen to look into that, and we're going to be collecting some case studies and for the sort of case for support to make the case, so that if a centre does want to try and go for a greater resource in that area, they've got a really good evidence base to sort of say, well, this is what it looks like in other centres, this is the impact it's had, this is the benefits of having it in place. But it's not all about psychologist support in centres as well. It's also thinking about the support that's available for the wider multidisciplinary team and the other charity partners that work in those spaces as well, and that can be referred to. I mean, one of the things that, unfortunately, just before I dropped my notes and I lost my track of thought of where I was in the presentation, but one of the stark things about the survey was that 53% of people were unaware if there was mental health support available at all. And I think maybe just making it more visible about what support is available. You might not need it at that point, but we all have mental health, right? And we need things at different times and different places. So just making sure that that's more visible about what support's available, we thought would be really helpful. We shouldn't underline the importance of early intervention. I think Patricia just made that point in that presentation. Like the what might be seen as the lighter touch stuff, like the peer support and the events and the activities and everything, are absolutely integral to reducing some of the issues that can escalate if they're not tackled up front. So and I think the final point is that support and caring communities that we've worked with, a group of young people that you saw before, to talk about schools and the role of schools. And I know it's really tricky at the moment because I've got lots of friends in schools that say every week there's another thing that they need to solve, another problem and an issue that it's their responsibility to deal with. But there is quite a big focus at the moment on mental health support within schools, and is there opportunities there to make sure that schools are and that support that's being put into schools is just as supportive for children and young people with long-term health conditions as it is for a wider health, a wider school population. So just a few things.
Yeah. I mean, from a Teapot Trust point of view as well, I think one of the things that comes out, we've got art therapy projects and obviously quite a lot of hospitals across Scotland and England, and what we see that really works is when that art therapist is part of that multidisciplinary team and works, as part of that. But it's the family support as well that is really, we would like to do more work with as well, to make sure that art therapy is not just for children and young person, but with the families themselves, which obviously Gain is an amazing example of. I don't know, Patricia, we're just about to come to our time and for this session, but I just wondered if there was anything else you wanted to highlight in terms of what's the next steps for Gain and the findings and what's happening with that.
So yeah, I'll speak to that, and Samantha has asked a question in the chat, and hopefully Samantha, this will answer your question. So Samantha's asking, what tools did we use to get an evidence base? So there was a clinical nurse specialist had funding to do data gathering as part of this project. So she met with every family before the group and after the group to do some identified outcome measures and semi-structured interviews as well. And I did some semi-structured interviews with the therapist after delivering the group sessions. So all of that's been written up into a paper to share the next part of what we did, but also to help shape the next group that's going to be delivered. And Samantha, you asked if any of the art making was supportive. The parent who used the resources fed back that she found it really supportive to have a chat with her daughter about things that she didn't know her daughter was worried about. So it helped to bring up things that they could then chat about. That answers your questions. Thank you.
Great. Well, thank you very much, both of you. I think Sammy might have left. I was just going to say thanks to Sammy, but I think she's had to leave. So thank you, Lynn, and thank you, Patricia, for that really insightful presentation.